morning, you open your eyes and immediately your body aches, your head begins to pound, and it takes everything you have to crawl out of bed. In order to begin the day, you have to take your meds whether you want it or not. Without it, you'll be sick, unable to function, and your body and mind will pull at you for it, overriding your every thought. It's not cancer, diabetes, or heart disease. It's the disease of addiction. Some say substance abuse, whether it involves illegal drugs or alcohol, is a choice of free will. It begins with a chosen behavior, but results in illness or disease. It affects our brothers, sisters, mothers, fathers, best friends, spouses, or even our children. We may not initially understand it, but through a little knowledge, we're able to help our loved ones in need. The better we understand this disease, the better we can help those affected by it. I've had personal experience with family members as well as patients who have been encountered with this disease. With wanting to help those closest to me and be a better patient advocate for my patients, I've done some research. The Betty Ford Center is a great place. It's a rehabilitation center, and if you call them or get on their website, there's plenty of things to look at and be able to better understand this disease addiction as a disease. First, I want to touch on how we classify addiction as a disease, then how addictive brains are different from normal brains, and that there is effective treatment for this disease. Some may ask, how is addiction a disease? Recovery First states that addiction is a neurologically based disease where the target organ is the brain. Addiction involves the limbic system part of the brain. This is our subconscious part of the brain that involves our emotions, rewards, and pleasures. Just like any other disease, this one relapses, remits, and is as powerful. It's chronic and is without treatment, it results in death, and the symptoms are progressive just like any other disease. Now that we discussed how they classify it as a disease, let's talk a little bit just how an addictive brain is different than a normal brain. An addictive brain is overpowered and controlled by the limbic system. That's our pleasure center in the brain. It becomes rewired to tolerate increased amounts of the neurotransmitter dopamine, which produces copious amounts of rewards and pleasures, and that's what the addict brain chases after, those copious amounts of rewards and pleasures. Where the normal brain, the neurotransmitters are balanced enough to control that and have self-control over it. Now that we have discussed how it's classified as a disease and how an addictive brain is different from, let's talk about that there is treatment just like any other disease. First, medically assisted detoxification is the first step in treating any addiction, detoxifying first. And most of the time you want to be in a rehabilitation center because it is deadly. Then along with that is behavioral therapy, and then there also is medications just like any other disease to help cope through this. In conclusion, with the right knowledge, we're able to understand addiction as a disease, how an addict's brain different from a non-addict's brain, and that there is treatment like any other disease. Addiction is a very complex but treatable disease that affects the brain. It not only destroys the person, but everything around them. We are responsible for learning the truth about this disease, raising awareness about it, and intervening with those with this addiction disease. Addiction is not just a state of mind, it is a disease. If you had cancer, would you do something about it?